Hello, everyone, and a warm welcome, and thank you for joining us on the program. Now, we would love to not to start with some gloomy news, but then this is what we have, which in fact emphasizes why it is important to take great caution and respect all the necessary measures put in place during these times. Globally, more than 2.3 million people have been infected by the novel coronavirus, and more than 164,000 people have died. The latest figures are according to a tally by Johns Hopkins University. And in Africa, the number of deaths rose by 55 in the last 24 hours, with a total toll now at 1,080. Data compiled from the Africa Centers for Disease Prevention and Control show that total cases on the continent had reached over 21,000 after 1,047 additional cases. North Africa has been the hardest hit on the continent, followed by western, southern, central, and eastern regions. A top government official in Guinea and close ally of President Alpha Conde has died from the disease. Sekou Kourouma, who was Secretary General of the government and a former minister, died in Conakry on Saturday. And in Nigeria, Chief of Staff to President Buhari has also died from the disease. Now we are reaching you live from our studios in Point Noir, the Republic of Congo. And over here, there's been an increase in the number of coronavirus cases. 143 cases now, the health minister, Jacqueline Lydia Mikolo, says. The Central African country, which is, in fact, in the third week of a one-month lockdown, has a population of around 5 million people. And the sudden increase in the number of coronavirus cases has got the government talking. For more on this now, we're now being joined by the country's communication minister, Thierry Mungala. Mr. Mungala, good morning to you, and thank you very much for joining us on the morning call. So it is now almost 3 weeks after the introduction of containment and curfews to stem the spread of coronavirus in Congo. First off, how has this gone, and what lessons have we learned so far?
La première leçon, c'est que ces mesures étaient nécessaires.
The first lesson is that these measures were very necessary because, despite all the imperfections, you can see that the curve is rising quite quickly. We have gone from a few cases to about 143 today. And as members of the government, we think that the life-saving measures that have been taken make it possible to slow down the curve, which would probably have been greater than what we have today. And secondly, the observation is that the confinement is indeed the most mitigated measure. This is so because some compatriots believe that they have to try to survive, to cope with their daily life, more than to prioritize the sanitary rules that have been enacted by the government. Thirdly, it is clear that Brazzaville and Point Noir are by far the two main centers of the pandemic in our country. And that said, and as I earlier mentioned, despite the imperfections cited in the strict measures imposed, I believe that the measures were necessary because they make it possible to slow down the evolution and progression of the disease in Congo.
Mr. Mungala, you talk about the slowing down of the progression of the disease. Overall, what is the current situation of the pandemic in the country?
A total of 5 districts are concerned. The bulk of contaminations are in Brazzaville, which has about 100 cases, and Point Noir with about 20 or 30, and the rest are being dissipated in other districts. For the time being, thank God, we have only 6 deaths to deplore. It should be noted that these deaths are often due to the fact that the compatriots concerned often arrived too late at the competent services, and at a time when, unfortunately, on the clinical level, it is no longer possible to do much. And finally, on cases that are taken care of on time, it should be noted that, for the moment, there is a great stability and there are no cases of extreme seriousness that could lead to the involvement of the physical integrity of the patient concerned.
So you've mentioned some of the case numbers there. According to the latest figures, the number of infected persons the number is not put at 143. Clearly a case of increase despite the stay-at-home lockdown and curfew. How can this upward trend be explained and curtailed?
First of all, there is the fact that there are compatriots who, unfortunately, and for reasons I mentioned earlier, continue to go out. Well, it should be understood that the government has not totally forbidden people to go out. There are movements that are essential, going out to buy food, medicines, and essential services. In the context of these outings, and even in the context of compatriots who don't really respect the confinement, the real problem is the non-respect of barrier gestures. I'm telling our compatriots through your platform that if they were forced to go out, at least during their outing, that they should respect the barrier gestures. If possible, have a distance of 1 meter of any person in the neighborhood. If possible, wash your hands regularly with soap or hydroalcoholic gel. And in any case, as far as possible, also wear a face mask and thus avoid any situation of promiscuity when you unfortunately find yourself in the market. Because there is a big black spot in the markets today that create promiscuity where it is difficult for sellers to be distanced from each other or from their customers. Unfortunately, there is a fear that this is potentially a very important factor of contamination.
Absolutely very important to keep ensuring all of the safety measures. Mr. Mungala, this is where we'd have to leave it at though. I'd love to thank you for your time and for sharing with us the latest government efforts in dealing with the pandemic in Congo. Thank you very much.